Assalamu alaikum. My name is Dr. Anwar Farooq. Today we will be talk about primary biliary cholangitis. Definition of the primary biliary cholangitis, symptoms of the primary biliary cholangitis, causes of the primary biliary cholangitis, risk factor of the primary biliary cholangitis, complication of the primary biliary cholangitis, and last treatment of the primary biliary cholangitis and diagnosis also. So let's start our lecture about primary biliary cholangitis. What is the definition? Primary biliary cholangitis, previously called primary biliary cirrhosis, is a chronic disease in which the bile duct in your liver are slowly destroyed. Bile is a fluid made in your liver. It aids with digestion and help you absorb certain vitamins. It also helps your body get rid of the cholesterol, toxins, and worn out red blood cells. Chronic inflammation in the liver can lead to the bile duct damage, irreversible scarring of the liver tissue, cirrhosis, and eventually liver failure. Although it affects both sexes, primary biliary cholangitis mostly affects women. It is considered an autoimmune disease, which means your body's immune system is mistakenly attacking healthy cells and the tissue. Researchers think a combination of the genetic and environmental factor trigger the disease. At this time, there is no cure of primary biliary cholangitis, but medication can slow liver damage, especially if treatment begins early. Symptoms of the primary biliary cholangitis. People with primary biliary cholangitis don't have any noticeable symptoms. The disease may be diagnosed when blood tests are done by other reasons. Common early symptoms include fatigue, itchy skin. Later signs and symptoms may include dry eyes and mouth, pain in the upper right abdomen, swelling of the spleen, splenomegaly, bone muscles or joint, musculoskeletal pain, swollen feet and ankle, edema, build-up of fluid in the abdomen due to the liver failure, ascites, fatty deposits on the skin around the eyes, eyelids or in the creases of the palms, soles, elbow or knees, yellowing of the skin and eyes, jaundice, darkening of skin that is not related to the such exposure or hyperpigmentation, weak and brittle bones, osteoporosis, which can lead to the fracture, high cholesterol, diarrhea, which may include greasy stool, underactive thyroid, hypothyroidism, weight loss, causes of the primary biliary cholangitis. It is not clear what causes behind primary biliary cholangitis, but experts said it is an autoimmune disease. Researchers believe this autoimmune response may be triggered by environmental and genetic factors. The liver inflammation seen in the primary biliary cholangitis start when certain types of the white blood cells called T lymphocytes start to collect in the liver normally. Their immune cells detect and help defend against germs such as bacteria and viruses. They mistakenly destroy the healthy cells, leaving the small bile duct in the liver. Inflammation in the smallest duct spreads and eventually damages other cells in the liver. As the cell die, they are replaced by scar tissue called fibrosis. They can lead to the cirrhosis. Cirrhosis is scarring of the liver tissue that makes it difficult for your liver to work properly. Risk factor of the primary biliary cholangitis. The following factors may increase your risk of the primary biliary cholangitis. Sex. Most people with primary biliary cholangitis are women. Age. It is most likely to occur in people 30 to 60 year old. Genetics. You are more likely to get condition if you have a family member who has or had. Geography. It is most common in the people of the northern Europe, but primary biliary cholangitis affects all races. Complication of the primary biliary cholangitis. Liver scarring. People with primary biliary cholangitis and cirrhosis have a poor prognosis. Unlike veins, when blood flow through the portal vein is short, a blocked blood may back up into other veins. Usually, there in your stomach and esophagus. Increased pressure may cause delicate veins to break open, and blood bleeding is upper stomach or esophagus is a life-threatening emergency that required immediate medical care. Increased pressure in the portal vein or the portal hypertension, unlike spleen or splenomegaly, gallstones and bile duct stones, liver cancer. Weak bone or osteoporosis, vitamin deficiency, vitamin A, D, E, and K, high cholesterol or hyperlipidemia, decreased mental function or hepatic encephalopathy, increased risk of other diseases. Primary biliary cholangitis is associated with metabolic or immune system disorder including thyroid problem, limited sclerodermia or crust syndrome. Rheumatoid arthritis and dry eyes and mouth are called Sjögren's syndrome. Diagnosis: liver test, antibodies for the sign of the autoimmune disease, AMMAS, anti-mitochondrial antibodies, cholesterol test, ultrasound, fibroscan, magnetic resonance, cholangiopancreatomography or MRCP, magnetic resonance elastography or MRE treatment. There is a lot of medicine exists in the homeopathy, but the treatment start earlier. Thank you very much for like or share this video. Thank you very much for watching. Thanks.